And so you might ask, as many do, does the world need another reporting standard? Do we really need more disclosure? And the answer is no. No, we don't. Emphatically no. The world needs improved performance. The world needs performance to get better on those things that really matter. And so what SASB is really doing is sending a market signal on what matters in particular industries, in particular sectors. The things that SASB has surfaced in the working groups, the issues that have come to the fore, are really at the intersection of business models and sustainability factors. They're really at that intersection where we can take action. Innovating on these material issues represents the greatest opportunities for achieving competitive advantage and gaining market share. And that's why I say we're sending a market signal. In the healthcare sector, access to services is a key material issue. It's one at the heart of Obamacare and reform in the healthcare industry. And yet innovation is going on in this space every day. Facilities designed for wellness, that's also a key material issue in healthcare. Why? Because hospital stays are expensive and they're reduced when patients heal faster. And patients heal faster when the environments around them are designed to address their physical and mental well-being. So it's not just disclosing so that we understand downside risk. It's understanding how well-positioned companies are to seize the opportunities associated with managing these issues well. And healthcare is one of those industries that takes up the slack for all the other industries that are producing externalities, air pollution, creating chronic diseases, obesity from food. Together, we're shaping the standards for the healthcare sector so that they're actionable, they're cost-effective, and they're relevant to both corporate management and to investors.
But I mean, I was very interested in seeing the materiality mapping that you've done, and I was very happy to see that what you guys have come up with pretty much matches what we have, to the extent that it's business relevant. I mean, there are a few things that aren't relevant for our business, but in the big picture, it's pretty much spot on in terms of what we already are reporting on and what we're seeing as being strategically important inside of Novo Nordisk. So one of the things that other standards have been missing is a very specific definition of how to measure, which allows for all types of interpretations, and you can't benchmark, you can't compare. So I think that one of the things that we will be hoping for is some very specific and clear-cut definitions on how to measure these things. I mean,
question would be, what is Congress going to do about this? And what might the SEC and or any other regulatory agencies do? I mean, in terms of adopting all or pieces of this, and how they're going to enforce it, and what the compliance is going to be like?
I firmly believe, and that's what we're going to talk about today, that ESG performance, good performance on those metrics, and returns are not mutually exclusive. The number one consideration for investors when they're deciding whether to invest or not, can anyone guess what it is? It's management quality. It's all about management quality, management track record, who's at the helm, and ESG is becoming a more and more important indicator of management quality.
I joined the SASB Healthcare Industry Working Group because I consult many clients in that industry, mainly big pharma, but also some smaller biotech companies. And it seems to us this is a very relevant standardization initiative, even for companies who are not directly impacted, because they're probably not SEC registrants. But the success of this initiative will have an impact well beyond the US borders. If you look at the whole universe of issues that pharma and healthcare companies could deal with, how do you weight all this? And what came out top, through the materiality process is that it's mostly the social issues and not so much the environmental health and safety issues, which comes as a confirmation to me, like access to medicine, safety of drugs, and etc.
What I think is unique about SASB's approach is definitely the sector focus. What we've seen so far within sustainability reporting has been way too general and too little focus on material issue. It's simply become too broad in scope. So that's definitely where I see the advantage of the SASB approach.